FMD, a little-known health risk and the need for proper nutrition. Fibromuscular dysplasia, FMD, is a disease of the arteries and is thought to affect about 5 million otherwise healthy women in this country, a number that is even higher than instances of breast cancer. The disease is usually diagnosed by accident while ruling out other conditions, however more is being learned about the condition. Source: Weber 2010. In many of the people with FMD, there are no symptoms or any indication that anything is wrong. In others, there may be headaches or other ailments, depending on where the main problem is. In the kidneys, headaches, worse during exercise, side pain, high blood pressure, especially when it starts at a young age or is uncontrollable even with medication. In the neck, a whooshing sound or ringing in the ears, severe headaches, pain in the neck or shoulders, stroke symptoms which include loss of vision in one eye or weakness in only one side of the body. In the abdomen, limbs or heart, pain in these particular areas, unusual shortness of breath or fatigue when active and unintended weight loss. Source: Gornick MD. Testing for FMD. Most doctors have little information about this disease and very few of them regularly test for it. However, in those who are young, healthy and most importantly active and at their target weight, blood pressure might be the biggest tip-off that something is wrong. While hypertension is becoming more and more commonplace in teens and young adults in relation to the ongoing problems with childhood obesity, FMD can cause high blood pressure that is not affected by blood pressure medications in otherwise healthy and fit young women. When FMD is near the kidneys, it will cause the high blood pressure because the kidneys release a hormone to increase blood flow if they are not getting enough. This in turn will raise the blood pressure. There are two tests that can be done to suggest that the disease is present. The first is high blood pressure and the second is a sound which can be picked up by a stethoscope. This sound called a bruit, and it indicates disrupted blood flow. This may need to be requested, especially in young women because it is not typically done. Those who have high blood pressure, defined as over 120/80, do not automatically have FMD, even if they are fit. There are other factors that can cause high blood pressure, including the use of oral contraceptives and family history. Treating FMD medically. Once you know that you do have FMD, there are several medical treatments that the doctor may suggest to manage the risk factors. The control of the blood pressure will be one of the key steps for care, and will usually be accomplished with a combination of medication, diuretics, beta blockers, calcium channel blockers, ACE inhibitors, diet changes and adding a daily aspirin to keep the blood thin down. There might be another change for women who have FMD in regard to their exercise habits. Exercise guidelines for FMD sufferers. For most conditions, it is recommended that you increase the amount of daily exercise that you get, while for those who have FMD, the recommendations might be different. For most people, moderate cardiovascular activity, jogging, biking and swimming are good choices, is acceptable, as is light strength training. There are some restrictions for those with FMD which might change based upon where the problem is located. These restrictions include prohibiting yoga, heavy weights or extreme sports like skydiving for those with FMD in the neck. There should also be no contact sports or those that are fairly rough. Doctors suggest that those with FMD in the neck stay away from roller coasters and avoid going to the chiropractor. Exercise remains important to those with FMD for overall cardiovascular health and to control cholesterol and body weight. Women with FMD should make sure that they are always learning as much as they can about the condition and their need for exercise as well as what kinds of activities they need to avoid. Because there is limited information about the condition and many of the women who have it do not know, there is a Fibromuscular Dysplasia Society of America which has teamed up with the University of Michigan's Outcomes Research and Reporting Program to form the FMD Registry, which keeps a tab on patients. Using nutrition as a weapon against FMD. Whey protein may be beneficial in the battle against FMD for a number of reasons. First, whey protein may improve blood vessel function in otherwise healthy people and may also work via an ACE inhibiting activity, like the medications would. Whey also helps to make sure that the optimal intake of the other nutrients, protein, fat, carbohydrates, vitamin and minerals is realized. Whey protein powders are also very beneficial to enhance muscle recovery after workouts. Soy proteins, which are complete proteins, the only plant-based protein that contains all 8 essential amino acids, also lowers the cholesterol and the risk of heart disease. Like whey powder, soy comes in 2 types, concentrate and isolate. The concentrate is slightly lower in protein, while the isolate has much more protein and is more digestible. Egg protein powder is created from egg whites and is not only high in protein and fat-free, it is also considered to be the perfect protein food. Egg white protein is highest in the amino acids, which are alanine, arginine, glycine and methane. The fourth of the protein powders is rice, which is isolated from brown rice. This is also a complete protein source. Rice protein is also beneficial for vegans and vegetarians as well as hypoallergenic, making it perfect for those who need to worry about various food allergies. Source: sea gummies. Other protein supplement sources. In addition to the protein powders, which may be either a single protein or a combination, there are a number of other supplements which might be perfect for those who are healthy and active. This group includes protein bars, shakes and liquid protein shots. Protein bars. When looking for the right protein bar for you, make sure that you are finding those with high amounts of protein, but that are also low calorie. Make sure that there are not a lot of added sugars, or it will not be any more nutritionally valuable than a candy bar. You may need to experiment with a number of different brands and flavors to find the one that suits your needs and your tastes best. Protein shakes. There are a number of commercially available protein shakes, but again make sure that there is not a lot of added sugars and that they have a good amount of protein per serving. Liquid protein supplement shots. Because FMD affects women who are typically healthy, active and fit, the protein supplements that they choose should be small enough to carry with them in a gym bag or pocket, should be low in calories and give good amounts of protein per each serving. ProfectR is a liquid protein supplement shot from Protica which comes packaged in a practically unbreakable plastic vial. It is only 2.9 fluid ounces with 25 grams of protein per serving. With 0 carbs and 0 fats, there is only 100 calories per serving.